just a few days after the CDC updated its COVID guidance online to include airborne spread, they're backtracking.
And the government agency says the information that was posted was in error. On Friday, the website had been updated to consider COVID an airborne virus and said it could be spread, quote, by respiratory droplets or small particles, such as those in aerosols. So we want to try and clear things up this morning. We're joined, as always, on Tuesday mornings live, Dr. Dana Hawkinson from the University of Kansas Health System. Doctor, the CDC's error had a lot of people kind of looking two directions with the COVID-19 yesterday. Tell us about the difference and how COVID-19 is different from just an airborne disease. What are you trying to explain to people after the CDC's backtrack?
Yeah, it's been tough. You know, we really try to give you, the community, the most up-to-date, accurate information. We certainly rely on the CDC and the state health departments for some of our information. It is difficult because if you do read that headline, you really think it's airborne. Really, the classic sense of an airborne infection is going to be measles, where it can hang in the air for hours, especially if somebody has walked through an area. This is not that. If you do read the headline and the further statements down in the information, they continue to talk about droplets and aerosols, just basically what is the size of those droplets and aerosols. If this were an airborne virus like measles, you would expect to have much more infections than we do now. The surgical mask that I wear every day in the hospital probably would not protect me. That is not what this is. It is still really respiratory droplets. In that article, they do talk about, or in that statement, they do talk about the size of those droplets. And that is really nothing new than what we have said from the outset about the size of respiratory droplets and the way that this virus can spread. So I know it did cause a lot of confusion, but it still doesn't change anything that we have said. It doesn't change anything about our practices here in the hospital, and shouldn't change any of the other public health guidance, such as distancing and mask wearing.
So the difference being something like measles can stay intact in the air for a long time versus respiratory droplets, where proximity matters. And are pieces of the virus smaller? I mean, what other differences are there in the way that it stays in the air from something like the measles?
Yeah, and some of the things that they have talked about in those statements were not necessarily pieces, Lindsay, but certainly the size of the droplets can maybe stay hanging in the air a little bit longer than just coughing and having the droplets drop to the ground. So you can maybe have some dispersal. They noted a couple articles that we've talked about on the show and that we've talked about internally that deal with, we know that the virus can be seen down the hall or in other rooms. Again, that is nothing new, but what is the actual concentration of that virus that is reaching that distance from the person who's expressing it? And is that going to be any significant consequence to causing infections? Certainly in the healthcare system, we haven't seen that. But again, it still goes back to time with somebody who's infected and proximity to somebody who's infected, where that concentration of those droplets are.
Okay, doctor, a lot of students in our area back in class. Yesterday, doctors at KU Health explained we really won't be able to see how schools are coping with COVID-19, if there might be a potential spike in cases until October, maybe even November. Why so long?
Yeah, what we have seen, and especially from the reopening, if you go back to the holidays after the reopening, we have seen that it is 5 or 6. It is a couple, 2 to 3 infection cycles before we start to see that spike of new cases. And it just does take time because people will be asymptomatic. We know the incubation period can be up to 14 days. We've had an employee here who was exposed but didn't have symptoms for 12 days. So obviously if we would have tested them at 8 or 7 days. So because of that incubation period, which can be up to 14 days, sometimes longer in a very small percentage of population, that is why it does take those 2 to 3 infection cycles to really understand the breadth of the not spike, but the breadth of the spread of the disease after reopenings or after certain events occur.
Well, Dr. Hawkinson, thank you as always. As you know, as our viewers know, there's lots of different places to get information. We're glad you continue to be here with us on a regular basis to provide accurate, up-to-date information for our viewers and let us know what's going on. Doctor, thank you as always.
Thank you.
And I always feel like we could talk to Dr. Hawkinson a whole other hour. Well, that is why
Absolutely.
he joins us every Tuesday morning on 41 Action News Today. So please reach out on social media. If you're sitting there going, but what about this? Email us, tweet us, Facebook us, and we can ask Dr. Hawkinson for you right on TV.